conduction of neurons. The axon diameter has a big effect. Large axon diameters cause a fast impulse. And myelination, the more myelinated it is, the faster the impulse. And this is because of saltatory conduction, which we'll look at in just a minute. Myelination insulates and prevents leakage of the charge. And saltatory conduction, which is about 30 times faster, actually jumps from one to the next. Voltage-gated sodium channels are located at those nodes. Okay, we all know a slug is very slow, and he moves along slow, whereas a grasshopper goes boing, 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 right? He goes fast because he jumps from place to place. Same thing happens with your axon when you have saltatory conduction. Between these little myelinated areas, the electrical charge, the active potential, jumps from node to node where you have a concentration of sodium-gated, voltage-gated sodium channels. Jump, 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 and it greatly increases the speed of transmission. Multiple sclerosis is an autoimmune disease. Now, what causes autoimmune disease is still somewhat up for grabs, but it actually destroys, damages the myelin sheaths and causes shunting and short-circuiting of nerve impulses. And the impulses the conduction slows and may even cease. It often starts as visual disturbances, muscle weakness, loss of muscle control. You get atrophy, you get slow reflexes, speech disturbances, urinary incontinence. Also, because it does affect the central nervous system, is associated with some psychological issues such as depression. That may even be the first symptom that a patient has, but it is diagnosed ultimately with an MRI of the brain. Nerve fibers are classified into group A, B, and C. A is large myelinated fibers. These are going to be motor or sensory fibers of the somatic nervous system. Group B fibers are going to be intermediate, lightly myelinated, and that's in the autonomic nervous system. Group C, smallest diameter, unmyelinated, again in the autonomic nervous system. You don't have to tell your gut to move quite as fast as you do your legs when you're running. A synapse is a junction, a connection from one neuron to another neuron, or from the first neuron to an effector cell. And it means gap or connection. So you have the presynaptic neuron, which is the one before the synapse, and then the postsynaptic neuron, which transmits impulses away from the synapse. And this is a picture of depiction of several types of synapses. This would be your axosomatic synapse. So the axon is actually attached to the soma of that axon. Now, there are electrical synapses, though they're not terribly common, where you actually have electrons, the neurons are electrically coupled with a gap junction. It's very rapid, can be unidirectional or bidirectional. Not common except in embryonic nervous system and some brain regions. Chemical synapses are the general norm, and it involves the release of neurotransmitters. And two parts, the axon terminal of the presynaptic neuron, it has synaptic vesicles, and then a receptor on the postsynaptic neuron. And then the synaptic cleft with fluid-filled division between the two, and it makes sure that your impulses only go one direction from the presynaptic neuron to the postsynaptic neuron. So it is a chemical event when you have transmission across the synaptic cleft. So you have release, diffusion, and binding of neurotransmitters. It only goes in one direction. Information transfer, going to go ahead a couple of slides. Okay, if you have your action potential going down your presynaptic neuron here, It moves on down. So we have negative, 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 which is what electrical charge is. And it triggers voltage-gated calcium channels. And this causes calcium to go into the cell. Now, anytime calcium gets loose inside a cell, things change. And what happens with this, in this case, is these synaptic vesicles move up to the edge, to the end, and release their neurotransmitter into the synapse. So, and then you get, and by exocytosis of the neurotransmitter. And it diffuses across the synapse, binds to receptors, and this causes channels to open, ion channels to open, and they may be excitatory or inhibitory. And initially, we're just going to get graded potentials, but once you get enough graded potentials, then you're going to get an action potential. Okay, and this is showing the neurotransmitter binding here, and you have the opening of the ion channel, and that ion is going to be sodium. Sodium moves into the cell. It's positively charged. When you move positive in, you leave negative behind. Okay, when you get through these neurotransmitters, you got to get rid of them to keep the signal from continuing over and over. Some chemicals are, we say they are reuptake. We have reuptake inhibitors for some, like serotonin reuptake inhibitors, which would be Prozac, fluoxetine would be one example. So they just go back into the original neuron and they're recycled. Enzymatic degradation. Acetylcholine is degraded by acetylcholinesterase, and then the pieces are put back up into the original presynaptic neuron and back together and recycled. And then some just diffuse away from the synapse, which takes longer, but none of it takes very long. So synaptic delay is just by the very nature of having a synapse, we're going to have a delay in transmission. And it is a limiting step in neural transmission. 0.3 to 5 milliseconds, not much to really worry about. Okay, postsynaptic potential. Okay, first we're going to talk about graded potentials, because you got to get enough of a graded potential to get an action potential. Because graded potentials are going on that neurotransmitter, and when you get enough sodium in the cell, enough negative outside the cell, then you're going to get the voltage-gated sodium channel triggered and get an action potential. Okay, the strength of these potentials depend on the amount of neurotransmitter released, so the more that's in the synapse, and the amount of time it hangs out in the synapse. Now, some potentials are excitatory and some are actually inhibitory. Okay, with excitatory potentials, sodium influx is greater and you get a depolarization. And ultimately, you get, if you have enough to get the threshold pass needed, you get voltage-gated sodium channels opening and you get your action potential. Inhibitory actually cause a hyperpolarization, and you can't get as much, it's harder to get an action potential when you have an inhibitory potential going on. Now, there are many, many types of neurotransmitters, and we're going to talk about them based on function and structure. Okay, the first is going to be acetylcholine. We've already talked about it at the neuromuscular junction. It's also active in a lot of the autonomic nervous system. It's synthesized by choline acetyltransferase, and it's degraded by acetylcholinesterase. In central nervous system, at the neuromuscular junction, it's going to be excitatory. So you're going to make things happen, move things along. Smooth muscle, skeletal muscle, increases the chance of having movement. In the cardiac muscle, acetylcholine is actually inhibitory. It's going to slow the heart rate down. Now, acetylcholinesterase breaks acetylcholine down at the synapse. So ultimately, the longer acetylcholine is in the synapse, the more contractions you get. Now, sarin gas is an acetylcholinesterase inhibitor. This is the nerve gas in the Middle East. People who are exposed to this get overstimulation to muscles, brain. They have respiratory failure because their respiratory muscles seize up, and the heart slows to where it's non-functional, and they die. Now, pyridostigmine is also an acetylcholinesterase inhibitor, and it is used two things. One is to treat myasthenia gravis, which is a disease in which, for generally autoimmune, there are types that are genetic that are just being discovered, but whatever the cause, you don't have enough acetylcholine or acetylcholine receptors at the neuromuscular junction, so you have muscle weakness. And pyridostigmine is given to decrease the amount of acetylcholinesterase, so you get more essentially bang for your buck. One release of acetylcholine lasts longer than it would have without the drug. It's also used for military troops to help them adjust to having too much acetylcholine. And it's just like when you start smoking cigarettes, you get used to nicotine. Well, when you take acetylcholinesterase inhibitors, your body gets used to them and adjusts to them. So then if they are exposed to nerve gas, sarin gas, they quit taking the pyridostigmine and their chance of dying is greatly decreased. Some insecticides, most of the older, well, all the older organophosphates were acetylcholinesterase inhibitors. Pyrethrins as well as permethrins are not acetylcholinesterase inhibitors, but some of the more modern drugs that are sprayed by the professionals are acetylcholinesterase inhibitors, and they can be deadly to children and pets. So you need to get them out of your house when your bug spray man comes, because they can die. Alzheimer's treatments are acetylcholinesterase inhibitors. Now, this drug, pyridostigmine, does not cross the blood-brain barrier, so it does not do any good in leaving more acetylcholine in the brain. But drugs such as Aricept are acetylcholinesterase inhibitors that do cross the blood-brain barrier, and they allow more acetylcholine to be in the areas where memories are retrieved, and can give a person several more years of an active, normal lifestyle when they are caught with the early onset. It's not going to cure the disease. It's not even going to slow the process. It's just going to relieve symptoms. Just like you take aspirin, it's not going to cure a brain tumor, but it will help you with a headache. Okay, classes of neurotransmitters. First, we have biogenic amines, catecholamines, dopamine, norepinephrine, and epinephrine are in these categories. Epinephrine and norepinephrine, we'll talk about our cardiovascular system. Epinephrine greatly increases the rate of contraction of the heart and the force of contraction, as well as doing a lot of other things. Norepinephrine actually causes vasoconstriction of blood vessels. Dopamine does a lot of things. Some we don't know what it does, but we do know that lack of dopamine in a particular part of the brain called the substantia nigra leads to Parkinson's disease. And so that disease is treated with a drug called L-DOPA, because dopamine won't cross the blood-brain barrier, but L-DOPA does cross the blood-brain barrier, and therefore makes more dopamine available to the Parkinson's patients. We discussed in class the effect of cocaine on dopamine release. Cocaine causes a massive release of dopamine at various parts of your brain. And then it uses up all your dopamine, and the person who crashes after they've had a cocaine high and they're addicted to it and they feel terrible, it's because they've run out of dopamine, and can't make enough more to catch up with their use of it. So they use more cocaine. We read an article that said that research has shown that cocaine users are much more likely to have Parkinson's disease than the straight-run population. And the theory on that is basically the same theory as people who drink Cokes all day and eat ice cream and everything that's good for you and tastes wonderful. Actually, it's bad for you and tastes wonderful. Burns out your insulin receptors. Well, cocaine burns out your dopamine receptors. Okay, indolamines, serotonin, and histamine are indolamines, and all these are broadly distributed in the brain, and they all the drugs on this page, all the neurotransmitters on this page, a huge role in emotional behaviors and the biological clock. Okay, serotonin, low levels of serotonin has been associated with depression. An uptake inhibitor of serotonin, selective serotonin uptake inhibitor, is fluoxetine or Prozac. It was the first purely selective serotonin uptake inhibitor on the market. And it actually does help a lot of people with depression. There are many, many antidepressants out there, but that's one of the more popular, probably because there's a generic available and it's cheap. Fluoxetine is also approved for 2 non-human species, bears in zoos that are unhappy because they're confined, and then unhappy dogs. In dogs, we find sometimes it greatly improve their attitude, they're happy, they're healthier. Others become aggressive. And there are warnings with Prozac in humans that if you start on this fluoxetine, that there are some individuals that become more depressed and actually commit suicide. Dogs are more likely to commit homicide than suicide, so just keep that in mind. They may actually bite. Have to be watched very carefully. A better thing for dogs is to take them for a nice 2-mile walk every day. One has to wonder if the same thing wouldn't help humans a lot to just increase the exercise. Okay, next chemical class, amino acids. Gamma aminobutyric acid. Gamma didn't make it in the translation from one program to the other. Glycine, aspartate, and glutamate are amino acids. We have a little more on those as we go along. Peptides or neuropeptides, substance P, seems like they could get a better name than that, but it's a mediator of pain signals. And then endorphins reduces pain or the perception of pain. So you go out and you exercise and you just feel great afterwards, even if you know you've overdone and you're going to hurt later. That natural high of feeling wonderful after exercise is because of endorphin release. And some people actually become really addicted to exercise. I personally have not had that problem, but some do, and over-exercise and lose too much weight. Okay, purines act in both central and peripheral nervous system, and they can provoke pain sensation. Okay, gases and lipids. This most fun one to talk about is nitric oxide. It affects arterioles and actually causes vasodilation. It was originally Viagra was invented to be a good blood pressure drug because it caused release of nitric oxide as a neurotransmitter to the receptors on the arterioles throughout the body. And they thought, well, if we can dilate all those vessels, then we'll lower blood pressure. Apparently, it just did not work out very well for that. However, the release of nitric oxide at the end arterioles that feed the corpora cavernosum of the male penis cause an influx of blood into said organ. the influx of blood due to the anatomical structure of the organ causes compression of the veins, and so you get more inflow, less outflow, and thus you have under parasympathetic stimulation and release of nitric oxide, you have the erection. Actually, the ejaculation is under sympathetic control, and some people who have bad hearts and then take these Viagra, Cialis, there's some other drugs, I don't know the names of them because I don't do humans, but they actually, right at the grand finale, if they had a heart attack fixing to happen, that's when it will happen. We had one paramedic say she's picked up several guys that had died as a response of this drug, Viagra being such a good drug, but they died when that sympathetic surge hit them. When they were gone. They're smiling. Okay. Now, also, nitric oxide and other gases and lipids are also involved in learning and memory. So that would be in the brain. Endocannabinoids. Cannabinoids you're used to hearing about. These are actually normal things in the brain are involved in learning and memory. Neurotransmitters may be excitatory, which causes depolarization, or inhibitory, which causes hyperpolarization. And it depends a lot on the receptor type of the postsynaptic neuron, but gamma-aminobutyric acid and glycine tend to be inhibitory, decrease the chance of an active potential. This is why if you're knocking down a couple of beers while you're listening to this particular lecture, it may make it less painful, but it will also inhibit your ability to think straight because the alcohol causes release of gamma-aminobutyric acid, and it is an inhibitory neurotransmitter. And so you become dull and you don't think well, you don't have good reactions, and you forget how to spell gamma-aminobutyric acid. So better to wait until afterwards, or just listen again when it wears off. Acetylcholine is a neurotransmitter that may be excitatory, neuromuscular junctions of the skeletal muscle, of the smooth muscle, also excitatory in many brain cells, but inhibitory in cardiac muscle. Now we have patterns of neural processing. Serial processing, it either happens or it doesn't. Input travels along one pathway to a specific destination and you get a specific response. Reflexes are the perfect example. And you have 5 essential components to a reflex arc. Receptor, sensory neuron, central nervous system integration center, motor neuron, and effector. So as you look at this picture, this has to be the dorsal side of this spinal cord. This is a spinal cord. This has to be the ventral side because, as we'll learn later, the ventral aspect is where you have your motor function. So, and the dorsal side is where you have your sensory function. So this is dorsal. And the receptor, you have a stimulus like a pen stuck your hand. It sends a signal down across the sensory neuron to the spinal cord, where that is transmitted across the synapse to the integration center. So we got another neuron. And then we send a signal to the motor neuron, which moves to the effector and tells you to take your hand off of the pen or whatever was injuring you. And no brain is required for these reflexes. It's just absolutely an automatic response. Happens the same type every time, every way. We also have parallel processing. One stimulus promotes several responses. And this is important in higher mental functioning. Smell reminding you of an odor associated with experiences. And we talked about the class about putting an apple pie flavored or scented candle in a house you want to sell. might make it smell like mom and apple pie and increase the chance of selling the house. Okay, look at this. If you saw this picture, if you smelled these smells, would you get an emotional reaction? If it were in my house, I would get an emotional reaction. So would whoever was in there and made that mess. You want to take the trash out, you want to clean things up. Cat litter, oh my goodness, you got to get rid of the cat litter. So anyway, when you have one smell can cause multiple things. When we see this picture, we don't just say, oh, take the trash out or smell the smell. We know somebody's got to take the trash out. We may feel anger at the person who was supposed to take it out before it got so stinky. Same with the cat litter. We may feel anger with the person who was supposed to take it out. Okay, this sums up Chapter 11, Part B, and our next lecture will be on Chapter 12, and I will put it up as soon as I can get it to record. Thank you.